Good afternoon, everybody. Myself is Dr. Nirupma Singh. I am working as a dietitian in endocrinology department at Sanjay Gandhi Postgraduate Institute of Medical Sciences. I will present today on medical nutrition therapy in diabetes management. Diabetes is a chronic disease associated with abnormally high levels of sugar glucose in the blood, as pancreas produces little or no insulin. Prevalence of diabetes in world is 463 million people in the world and 77 million in India. There are main three types of diabetes, that is type 1 diabetes, type 2 diabetes and gestational diabetes. Type 1 diabetes is always insulin dependent diabetes mellitus. Type 2 diabetes and gestational diabetes may be or may not be dependent on the insulin. Major causes of diabetes is lifestyle, obesity, stress, heredity, smoking, some medications and gestational diabetes. Sometimes gestational diabetes, if not treated well or not controlled weight or sugar intake, then it will convert in diabetes. Major consequences of diabetes is diabetic nephropathy, diabetic retinopathy, diabetic neuropathy, diabetic cardiovascular disease, diabetic foot, and overall impression is depression. If a patient is having diabetes, definitely with all kind of diseases, all kind of comorbidities, but depression definitely will cause for other diseases also. Major symptoms of diabetes is polyphasia, polyuria, polydipsia, fatigue, frequent hunger, blurred vision, dizziness, irritating behavior, unwanted anger. Sometimes a normal person is started irritating on any nonsense things, then it may be, if it is frequently, then it may be the chances of the diabetes. Patient should go for the blood investigations. Diagnostic investigation is fasting blood sugar, postprandial blood sugar and HbA1c. And if a person is diagnosed as a diabetes, some other investigation which is required yearly, that is creatinine, urine RM, urine microalbumin, fundus, ECG and foot care for all diabetic patients on routine basis. If a person is having less than 100 milligram of mg per dl, that is the person will call non-diabetic. If a person is having fasting blood sugar 100 to 125 mg per dl, that is pre-diabetes, and more than 126 mg per dl is called diabetes. So number is very important. First, for postprandial, after 2 hours of the lunch, if it is less than 140 mg per dl, patient is non-diabetic. 140 to 200 mg per dl is pre-diabetes. More than 201 mg per dl is diabetes. Similarly, for HbA1c, if a person is having 4 to 5.6, that is normal. 5.7 to 6.4 is pre-diabetes. 6.5 and above are called diabetes. Urine microalbumin is diagnosed or investigation or test is done after the diagnosis of the diabetes. If person is having 30 mg microalbumin, that is normal. 30 to 300 mg indicates early kidney disease. Any of the first three, fasting, PP or HbA1c ranges, if varies, if abnormal, definitely go for the other investigation and go to the doctor for the treatment. Treatment therapy of diabetes is diet. First, if a person is having not much high blood sugars, diet and exercise can work, will play an important role. Diet, exercise and medication is second, and third is diet, exercise, insulin plus medication or anything else. But it is important to follow diet and exercise in all aspects or in all regimes. It is not possible without diet and exercise, diabetes can be controlled. Healthy eating habits and medical nutrition therapy is important in management of diabetes. Eating well will help to regain strength, rebuild tissue and feel better overall. Factors which affect nutrition need is age, gender, activity factor and nutrition status. Nutrition plays an important role in maintaining ideal body weight, maintaining blood sugar levels and overall improving the quality of life. If the 2 points, ideal body weight and blood sugars levels, are managed or under the control, the quality of life will be definitely improved. Medical nutrition therapy in diabetes is carbohydrate should not be more than 50 to 60%, that is complex carbohydrate, fat 20%, preferably MUFA and PUFA. For step 2, total fat should not be more than 20% of daily energy, 7% of energy from saturated fat, and 200 mg cholesterol. It should not be more than. For protein, if patient is having only diabetes, 15 to 20%. If patient is having any kidney disease or any impairment in renal impairment, then definitely the protein requirement will be changed. It is 0.6 to 0.8 gram. And if patient is on dialysis, it may be 1.2 to 1.5 gram per kg of ideal body weight. Fiber intake plays an important role in diabetes management, that is 28 to 30 gram per day. At least it should be included in the diet. For hypertensive or non-hypertensive patients who is having diabetes should not take more than 3 to 5 gram of normal iodized salt. Carbohydrate, protein, fat, vitamins, minerals, fiber and water are the main nutrients for the diabetes management. Simple carbohydrate, sugar, jaggery, honey, juices, sweets, cold drinks should be avoided during the disease of diabetes. Complex carbohydrate, dal, bran flour, besan, pulses and legumes, milk and milk products, vegetables are good sources for managing diabetes, that is complex carbohydrate. Protein plays an important role in bodybuilding, wound healing and increasing immunity. Milk and milk products, preferably low fat. Paneer should be low fat. Egg white, in place of whole egg white is better option. Fish, chicken cooked in less oil, all pulses and sprouts and all cereals containing protein, and that will help to maintain the blood body weight and definitely bodybuilding. This is a slide which I will say for all the students or whosoever is seeing will take the photo. It is giving a brief information about the calorie, protein, fat and carbohydrate. That milk should be toned. Paneer, if is using 50 gram, then how much calorie, protein, fat and carbohydrate will be given. So it is very important to know the nutrient available in the food products. Avoid or eat less simple sugars and sweets, jaggery and bakery products should be avoided during the in diabetes. Free foods is the key of management of the diabetes. Only nibu pani, salads, patla mattha can be the free food. Laya chana or any type of biscuits or any type of sugar-free juices, any type of sugar-free products can never be a free foods, cannot taken any time. Whenever we feel like to eat something, we eat laya chana. So it is not the good option. Free foods are only few that can be taken whenever you are feeling hungry and it is not time for your food. In management of diabetes, exercise is very important, as I told. So walking, slow walking, 100 to 200 kilocalorie per hour. If you are walking for 1 hour, it will spend 100 to 200 kilocalories. Cycling, 250 to 300 kilocalories. Golf, 300 to 350. Dancing, vigorous dancing, 300 to 400 kilocalories. Gymnastic, 300 to 500. Gym, 500. Jogging, swimming. So any type of exercises should be done or should be routine for the practice. At least 30 minutes per day. Brisk walk for half an hour a day, at least 3 to 4 times per week or every day in a week will important. Tips for healthy eating: a nutritious balanced eating plan. Choose a variety of food from all food groups. 2.5 cups of fruits or 3 servings of vegetables each day. Include citrus fruits and dark green and deep yellow vegetables. Eat plenty of high fiber foods like whole grain breads and cereals. Decreased amount of fat in meals by roasting or broiling of foods. Limited intake of red meat, beef, pork or lamb. Avoid salt, curd, smoked and pickled food. Choose low-fat milk and dairy products. Avoid alcohol. If overweight, losing weight by cut calorie and increase activity will help to managing the diabetes. Thank you. Any questions?